My name is Janice Linton, and thank you very much for joining us today to learn a little bit more about systematic and scoping reviews. Mê-Linh, Leigh, and I are two librarians at the Neil John Maclean Health Sciences Library. Mê-Linh designed the slides this year, and I'm presenting, and she's helping today. And we've been doing this systematic review workshop series for a number of years with our colleagues here at the Health Sciences Library. We have a lot of activity on the Bannatyne campus with researchers, students, and grad students in particular who are wanting to do this type of review. And it's a lot of work, a lot of steps involved. And so today I'm going to show you some different types of reviews, some of the steps involved, lots of resources. We've recorded this session. There's a lot of information, and you'll be able to access both the slides and the recording. And yeah, it's, as I said, a lot of information, and I'm very grateful that you're joining us today. To start out with, I'm just going to mention the traditional territory acknowledgement. We are on the original lands of the Anishinaabe, the Inninawak, the Anishinawak, the Dakota Oieri, and the Dene, and on the national homeland of the Red River Métis Nation. We respect the treaties that were made on these territories. We, our community at University of Manitoba, we acknowledge the harms and the mistakes of both the past and the present. And we do dedicate ourselves to move forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. And I'm grateful to have the opportunity to work with First Nations, Métis, and Inuit people here at the U of M. As a non-Indigenous friend to Indigenous people, I am devoted to being part of the solution rather than part of the problem. When it comes to taking action or speaking out to support equity, health, and wellness for Indigenous people. And I'm very grateful. I get to do that every day in my work. I'm very, very grateful. So today, as part of the 5-part series, we're just going to look at the essentials of systematic and scoping reviews. A reminder that it is a 5-part series, that you can register for each of the sessions, and we do record them. So if you have to miss a session, you can still access the recording, but you do have to actually register for each session, and they'll be held over the next few weeks. And as I said, I'm very grateful that Mê-Linh did today's slides. So we're gonna, for the outline for today, going to look a little bit at the housekeeping and contact information, where you can get some more assistance, looking at some objectives and an introduction to the reviews. It's a very high-level overview of these types of reviews. I'm going to go through the steps in a general way of what a review encompasses. And the review, we're going to look at two, we focus on health and health sciences, but we also will give you some resources and a little bit of information about reviews outside of the health sciences area. And then there'll be a wrap up. This is a 1-hour session. So just a reminder, please mute yourself and keep yourself muted. Keep the video off because we're recording, and Mê-Lin's monitoring the chat, so please feel free to ask questions. And here at the Bannatyne campus, where the Health Sciences Library is, we have a bunch of librarians. These are just some of the librarians currently. And you can actually book an appointment with a librarian to discuss perhaps what your research question is looking like, what type of review should you do, is a review appropriate for you? And also maybe one of the essential things that a few minutes with a librarian can just help you figure out which databases would be the best ones to use for your review. A lot of people just pick a bunch of databases that they sort of know the name of, but they don't really have the experience of a librarian who says, well, this database might be better than that database, and this one kind of overlaps with this one, and this database has more functionality for a review than another type of database. So that's pretty essential. And we also have quite a quite a large health sciences libraries website where you can find all types of information on how to do the reviews and the steps involved, as well as recordings of these sessions and past sessions as well. At the Fort Garry campus, we have a lot of librarians, really good librarians there too. They will also are essential if you're in sciences, engineering, humanities, education, for example. You might want to talk to your subject specialist librarian just to figure out which databases to use for a review and some other key elements, as well as just some really good practice in search strategies, some good tips. And on the right-hand side of the screen on this slide, this is a snapshot of the health sciences libraries knowledge synthesis section. So knowledge synthesis covers both scoping and systematic reviews, as well as other types of reviews. And we have a lot of information there to guide you on every step of the way. And also a reminder for people who are using the experience record, you can register and attend sessions that will receive credit for graduate students only on the experience record. And so the idea is to sign up, attend all the sessions, and you can get that experience record added that experience added to your experience record. And I'm just going to go over some objectives. I'm going to look at what a systematic review is compared to a scoping review. Those are the two most popular types of reviews, though there are other types as well. Look at the standard process for both types of those reviews with a focus on health sciences. We're going to identify tools and resources needed to complete the systematic or scoping review. And as part of the introduction, I'm just going to mention this. Oops, sorry, didn't mean to go that. So it's really about the contextualization and integration of research findings, looking at a whole bunch of individual studies. A systematic review must be reproducible, so that's part of the methodology. It must be transparently reported. And it can use quantitative or qualitative methods. It's useful in health sciences and sciences, as well as the humanities and the arts. Yeah, it's about looking for the evidence. So for knowledge synthesis, we look at it kind of as an umbrella of incorporates scoping reviews, systematic reviews, practice guidelines, rapid reviews, realist reviews, evidence mapping, and also sometimes meta-analysis is thrown in with systematic reviews as well. So we've also heard the term umbrella reviews. So an umbrella review is a review of reviews that was come up. There were so many systematic and scoping reviews published in the last 10 or 15 years that some people are actually doing a review of reviews, which is called an umbrella review. But it's bringing all that evidence together. So we're going to talk about systematic reviews specifically. The goal is to uncover all the available evidence. So you don't stop when you think you have enough information. You actually look at all of the available evidence. It helps confirm current practice, how we're doing things now in medicine, addresses any variations and identifies new practices, which is really good. So we're not just relying on, like a clinician, a doctor is not just relying on their experience, but that they actually have the evidence to back up the course of treatment for a patient, for example. To identify and inform areas for future research, and identify and investigate conflicting results. Produce statements to guide decision-making, as I mentioned. And a systematic review attempts to collate all empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question. It uses explicit systematic methods that are selected with a view to minimize bias, thus providing more reliable findings from which conclusions can be drawn and decisions made. And that's a great definition of what a systematic review is the goal of it. And it's really looking at that evidence. It's very important to have a specific research question, not just a topic. A lot of people work pretty hard to get that research question. It uses explicit methods that are predefined. So we write a protocol for what the systematic review, what the elements and steps are going to be. And that is usually registered or published somewhere. And that's to minimize bias. And I'll talk a little bit about that a little bit later. So the key elements, it's really a strong, I love this quote that Mê-Linh identified. A systematic review can only be as strong as the foundational data collection on which it stands. And that is so important. And that's why librarians get involved with systematic reviews and scoping reviews, because you can't do a really good synthesis of the evidence if you're missing a whole bunch of evidence. And fortunately, you know, you're part of an academic university community. So University of Manitoba Libraries has a number of databases for you to pick from so that you can identify all of the best evidence, and librarians to guide you to help you identify which databases and which search strategies are going to help. But it's really important that you have all of the evidence at hand in order to screen it for inclusion and exclusion criteria, and to synthesize it and to write a really good review that will stand for quite a while. You know, if you publish it, a review brings together the evidence for a number of years until it's superseded by new evidence. So it has to be systematic searching, systematic methodology, has to be very comprehensive so that you don't just search Medline, for example, or PubMed in medicine, but that you also search Embase, which is like PubMed's rival, as if you were doing a systematic review on a therapeutic or a new medicine. So it has to be comprehensive. You can't just focus on one set of data. You have to look at all of it. It has to be transparent. So you have to report the steps you took to actually carry out the review. And you really, I mean, the reason why we have the knowledge synthesis web pages at the Health Sciences Library, so that you don't miss a step, you know, because that can be really critical. And you do need the support as you do different tasks and different steps. So now we're going to look at scoping reviews. Scoping reviews are a little bit different. The way I look at systematic reviews is they're like the first type of evidence-based review. The methodology for systematic reviews was developed quite a few years ago for medicine particularly. Scoping reviews sort of came out of that. So systematic reviews tended to focus on quantitative results. You know, how many people in this study did better on this medicine compared to a different medicine, for example. And then scoping reviews started to look more at, you know, the qualitative information, for example, looking at where are our gaps in knowledge? How do we describe some research questions and topics that we're working on, that type of thing. So it's about identifying types of evidence in a given field, to clarify key concepts and definitions in the literature. That's often done, like, you know, what do we know about a certain topic? How do we define things? How do we define certain populations? Examine how research is conducted, to identify key characteristics or factors related to a concept. Sometimes, originally, these were kind of a precursor to a systematic review. I don't know as many people that do that right now. I've worked with a couple of teams that have done that, but not so much. Mostly people will do a scoping review as opposed to a systematic review, because they're really trying to get the lay of the land for what we know and what we don't know about a certain research question. But originally, it was to identify what we know and don't know, and then maybe to focus something on a more systematic review, but more in medicine. So as I mentioned, it's really to identify the knowledge gaps and to look at those characteristics. Narrative reviews, we we all do narrative reviews. We don't always call them narrative reviews, but those are foundational to what one would need to do a master's thesis or a dissertation for a PhD, right? Is often we need one or more narrative reviews to support our work. Sometimes a narrative review will look at, the rationale for doing something. It'll be a very comprehensive review, often looks like a scoping review because it's looking at all sorts of evidence. But you don't have to do quite as much work, and you don't have to report the work in the same way. It's really looking about what has been written on a topic, highlighting strengths and weaknesses. So it's areas of interest to you, for example. Likely use a selective sampling approach. I like to think of a narrative review as, I stop when I have enough information to authoritatively write about the subject or the research area. Whereas a scoping review or a systematic review, I have to look at every source of possible evidence. And with a narrative review, I stop when I have enough, right? Often we'll look at controversies, identifies future research questions. Often the analysis is conceptual, chronological, thematic as examples. Yeah, and places context, is very important in a narrative review. More and more narrative reviews these days are reporting. Often you put it in that early abstract or introduction to a narrative review. You explain that it's a comprehensive review, and you write a couple of lines about where you looked or how far back you looked in the literature, just to convince the reader that your review is actually a really good review and is worth reading. I'm not going to spend a lot of time on these slides because we have a number to go through, but this is why we put the PowerPoint up for you to access later, and also why we're recording this. So if you said, well, I'm kind of, somebody suggested I do a scoping review, but I'm kind of thinking I might be able to just do a narrative review. Narrative review is a little bit less work, or quite a bit less work than a scoping review, for example. And this chart gives you some information on what's the difference between these three major types of reviews. And especially when you're trying to refine what your research question is and what your goal and your focus is. So, for example, on the research question for a narrative review, it can be broad and not explicitly stated. It can be more topical. For a scoping review, it's broad and more exploratory, really looking for gaps, for example. And in a systematic review, it's a very focused question. It's a research question. It's very clearly defined, and it's applicable in certain circumstances. As I said, therapeutics in medicine, is a classic systematic review question. And also one of the other important points is critical appraisal. Critical appraisal is very important in a systematic review, but not necessarily in scoping and narrative reviews, for example. And that's quite a bit of difference in the type of review, the type of question, and the workload. Other differences, talk about the data synthesis, the bias, what the outcomes look like, and these show some differences. As I said, narrative reviews are very qualitative and descriptive. Scoping reviews are also qualitative, but may include numerical summaries. And a systematic review might have a meta-analysis. Not all systematic reviews have meta-analyses, but all meta-analyses have a systematic review, which is quite a bit of work and reportable. And then there are some other information there. And this is an example that Mê-Linh picked. And this is a good example of what some really key elements of your review. So this one's talking about the efficacy of smokeless tobacco for smoking cessation. It says a systematic review and meta-analysis. And those are one of the guidelines. Like there's a set of guidelines for what you need to include in every step of the review. So for example, in the title, you have to state what type of review it is. And we're going to look at the PRISMA guidelines in a few minutes. And so this one is a pretty good review because it states right up front, it's a systematic review and meta-analysis. So we know exactly what it is. And also, if you look at the abstract, it has a clear objective, talks about data sources and study selection. And this one, if you also look at the size of the team, there's a number of people on this team that worked on this. And that's probably because not only is it a systematic review, but it's a meta-analysis as well. So there's different steps, and different people with different experience and different strengths would be on the team. We'll compare that to a scoping review on a similar topic, looking at existing evaluations of smokeless tobacco control policies. So it's quite different. And then it says, what is known about countries covered, level of jurisdictions, target group studied, and instruments evaluated. So once again, it specifically states what type of review in the title. Because this is a scoping review, similar to a systematic review, it has a number of authors who provide different experience, strengths, and contributions to a review. It also has an abstract with a clear objective. It's a scoping review to summarize the studies that evaluated public policies on smokeless tobacco regulation, provides an overview of the jurisdictional level target groups and policy instruments. So it's more of a, it's a research, number of research questions will be answered in this, and they'll be presented a little later in the text of the article. But it talks about 7 databases were systematically searched, whereas with a narrative review, for example, we might not have used 7 databases. We might have just done a comprehensive search in a couple of databases. But it talks about not only was there 7 databases, they were systematically searched, and they had certain criteria that they had to meet in order to be included in the review. And the protocol was published beforehand with Open Science Foundation. And if we look at another review, this one's a narrative review. So this one has 3 authors, right? So not a much smaller team. And the abstract still has an abstract and aim and methods, but in this case, it was a literature search was conducted in PubMed with the aim of identifying relevant articles on residential treatment exclusively for tobacco use disorder. And then it talks about it's not so much of a systematic search, it's just a good literature search. And further on in this article, they describe with 1 or 2 lines what the search strategy was. So on this one, we're looking at knowledge synthesis. Once again, this is why we put slides up, is so that you can actually follow the links in this slide on your own time and look at some of the differences in the reviews. And we put up a question of which review is right for you. And this can really help you decide what type is right for you. A lot of people come to us and say, well, yeah, I'm doing a scoping review and I'm going to, and I've got like the next 12 weeks to do it, right? And they also have a whole bunch of other things going on in their personal and professional life. And I'm thinking, well, it's usually takes about 18 months to do a scoping review, with a large team of people. Somebody did an estimate of how long it takes to do a scoping review or a systematic review. 880 hours are contributed. That's what they estimated, based on pulling the team together, carrying out searches, doing the analysis, doing the screening. There were so many different areas and so many people to contribute that they added it up, and it was over 800 hours. The searches alone to design and carry out can take about 30 hours. That's pretty common. So deciding on your review type, it's always good to know the literature on your topic. And so I usually suggest to people, do some background searching, try a couple of different databases, see what's being written. That'll help you refine your question. It'll help you identify whether somebody else has done reviews on this, help you identify whether a review is actually right for you, or if maybe you should be doing a different research methodology. So how do people do reviews in your discipline? It's different in education than it is in engineering, than it is in nursing, for example. Where are you planning on publishing? I recommend to people that it's never too early to think about what's your goal. It's a lot of work to do a review. Where do you want to publish? If your goal is, you say, oh, I've always wanted to publish in Lancet, that's my goal. Find out, does Lancet even publish the type of review that you want to do? Do they charge for it? Does the university libraries have a fee waiver or a discount agreement with the Lancet, for example? There's a lot of different things to think about when you're thinking about publishing. And like I say, it's never too early to think about that and to, run your ideas past a librarian to make sure that you're going to put your research output, put that final article in a good place where it's going to be read and referenced by a lot of people and change a lot of people's lives. So you have to think about too, like how long do you have? A narrative review takes a lot less time than a scoping review. You also have to think about putting your team together. So how many people do you have that you can call upon to put some effort into this? The research question should dictate what type of research or evidence-based review should be done. And I can't emphasize that enough. Some people think, well, there's not much written on this topic, so we want to do a scoping review, right? And sometimes that's not the best thing. Maybe you need to go back and do original research. Maybe you need to get a grant to do some focus groups. That is a very different research method to answer a specific question. So you really have to think about, why have there already been reviews done? What am I looking at? How novel is my topic? How novel is my research question? So there's some methodological guidance that we're pointing to here. For systematic reviews, some people look at the Cochrane Handbook and Guide for Systematic Reviews, the Joanna Briggs Institute, the JBI Reviewers Manual also covers both systematic and scoping reviews. And it's from nursing, and a lot of people use it because it's very structured, has a lot of information, and you use the information that you need from the JBI manuals. Scoping reviews, what are they and how you can do them? There's a Cochrane link there. And as I mentioned, JBI covers both systematic and scoping reviews, for example. Very, very specific guidance. We also have, as I mentioned, the knowledge synthesis set of web pages for the Neil John Maclean Library. We have links to a lot of different steps and types of reviews and methodologies. And the reporting guidelines, I think most people in this session might have heard the term PRISMA, maybe seen a PRISMA flow diagram in an article that they were reading. It's the reporting guidelines for systematic reviews and meta-analyses. There's a number of different guidelines. So if you're writing the protocol, in order to publish the protocol, you might want to follow the PRISMA P for protocols. If you're actually writing up the article, the analysis article for scoping review, then you might want to follow the PRISMA guideline for scoping reviews. So there are a number of ones, as well as there's many more, but these are the popular ones. And you have to assess the need for a review. So one of the first steps that people take often is, if you're thinking of a systematic review for, say, medications, you would probably want to take a look in Prospero, which is the database of systematic reviews where they are registered. So every review that's systematic, scoping, umbrella, narrative reviews, or not narrative reviews, but the other types of reviews, they all have to be registered in one of these databases, because if you don't register it, you will have problems when you go to publish. So people often look in Prospero to see if somebody's already doing a review on their research question. If you have trouble searching Prospero, you can always ask a librarian for assistance. If you're thinking of doing a scoping review or rapid review or a different type of review, you might look at the registrations in the Open Science Framework. Once again, you really have to register your protocol in Open Science Framework if you're doing a scoping review. I have a little search strategy that I use in Scopus to identify all of the Cochrane reviews and the other types of reviews done in my areas. And I'll probably be sharing that in sessions 3 and 4 when we're looking at how to search the databases. So you really need to look at, is there already a review on the topic, and is there enough evidence on my topic? So background searching is key. And that's the fun part too, is sort of looking and getting some ideas and focusing your question and pulling together some information from best practices, from good reviews that you see and good protocols that you see published. And also, you know, sometimes you see a review that's not so good and you go, oh, well, I could do a better review. I'm gonna, you know, talk to a librarian for some guidance on which databases to pick, for example. And the steps in a review, and this is a very important slide. So thanks for including that, Mê-Linh. So really, you want to develop the research question. These are the steps that you will need to take. Each step takes quite a bit of time. Think about the team we mentioned, looking at assembling the team. Sometimes you need a statistician if you're doing a meta-analysis. Usually you need experts, for example. So if I was doing, if I was on a team, we were doing a scoping review for oncology, I might want an oncologist or an oncology nurse on that team. Librarians often have a lot of experience, can just help guide you. We teach a lot on how, not the methodology, but also the searching and the reporting. So it's always essential to look at who do you need on your team. Writing the protocol, there's lots of examples, and we link to them on our website. And also you can look through the OSF database. And often for students, I'll help them identify 4 or 5 good examples of a protocol compared to poor examples of writing a protocol. You have to perform systematic searches. So that would be multiple databases. Usually the libraries provide some really good access to some very structured databases that we purchase for you to use so that you can do smart systematic searching as opposed to just extra searching and spending a lot of hours on stuff that you don't really need to search and getting a lot of duplication. We can help you pick the right databases. We can also talk to you a little bit about the importance of gray literature. There's different types of gray literature that might be needed for a systematic review compared to a scoping review, for example. And section 5 here, screening articles. Most people here might know that you need inclusion and exclusion criteria. So I want to include this type of article, or this, I want to this covered for this type of population, but not that population. Or I mean this when I talk about inclusion, or this when I talk about exclusion. And it could be dates, types of publications, different populations, how they define for inclusion and exclusion. That is included in your protocol to minimize bias, to have a more rigorous review. And then once you screen it, that's quite a bit of time depending on how many articles you have. For a typical review, you might have, 1,000 articles, maybe 2, 3, 4, 5,000, but you're only looking at title abstract screening as your first level of screening. Assessing quality, we talked a little bit about that. Some reviews need it, some don't. There are appraisal tools, and we link to those from our website. Extracting the data, you need to think about how you're going to extract the data. What data do you want to extract? And each full text article that you think you want to include in the analysis that has made it through that screening so far, you want to have a consistent way to describe the findings of each research report or each article. So sometimes, that criteria, those characteristics, they're different depending on what the question is, and what the topic is. So you may want to look at that. Analyzing the data, that's kind of the fun part, but also it's a lot of work. But that's where you can really pull together the evidence, and you'll find things that you say, oh yeah, that makes sense, and you'll find things you'll go, I didn't realize that, because that's what the difference is between just having experience and an interest in an area and actually having the evidence in your hand. And this is very exciting when you're analyzing the data and you go, wow, I had no idea that there was a gap, or we have so much on this, or look at this story it's telling. And it's just amazing. And it's, once again, it's a great time to, touch base with your team, and they'll help you figure out what data to extract, and the analysis, they'll help contextualize the analysis so you can write a better article of your findings. And yeah, it's just, it's very exciting. Disseminating the results, by this time you're pretty tired of your research question, but you want to write up the results in a very compelling way in order to publish, to submit the article for publication in a quality journal. And this is where your team comes in to help you polish it and to submit it to a good journal. And I often say to students, why don't you just run past where you're going to submit it to, run it past the librarian, just kind of make sure it's in a good journal, that people are going to find your information and they're going to cite it for years to come, and you're really going to change lives. And there may be other ways to disseminate the results as well. So talking about developing your research question. So what a lot of people will have a topic, maybe have a research question, but almost always a research question needs a little bit of modification. You kind of hone in on what the question is, and it's a novel question to be answered that nobody's really asked before, and brought together the information and the evidence in the same way that you're going to. So we mentioned the which review is right for you. Different frameworks are used. Some people have a pretty good research question, but it just needs a little bit of refining. So they may actually put it into a PICO or a PCC model. We'll talk about that a little bit. And some people have a good PICO question, but they need to, they have a good PICO model, but they need to actually write it out as a research question, as 1 or 2 or 3 lines for their review. So PICO, if you're in medicine, you might be familiar with this, looking at population, intervention, comparison, and outcome. So in this case, the population is children with cancer. The intervention is medical cannabis. And looking at, can it reduce nausea, vomiting, and decrease pain and anxiety? So those are the outcomes. The comparison could be with an other medication, or it might be no comparison. It might be compared to the other arm of the study was children who weren't given medical cannabis, for example. Here's another different framework altogether called SPIDER. Once again, it can help you identify, so your sample or your population, the phenomena of interest, what are you interested in, the design, and evaluating that, and the research type. So what are the experiences of young parents in attendance at antenatal education classes? And that might be, a good scoping review, for example, and less of a systematic review. PCC is another popular one. I work in population health a lot. So we look at population, the concept and the context. So in this case, what quality of life questionnaires are available for pediatric patients following tonsillectomies, with or without adenoidectomies, for chronic infections or sleep disordered breathing. So quite a bit of information there, and that would help feed into what are your inclusion and exclusion criteria. So you would ask things like, what do you mean by pediatric patients? Is that children under 12? Is that children under 16? Children under 18? Children under 21? What do you mean by tonsillectomy? Does it have to, be a certain criteria? What do you mean by sleep disordered breathing? Assembling a team, we talked about subject experts, but also it's good to have people who have done, if you're doing a meta-analysis, have somebody on the team who's done a meta-analysis before. Librarians often kind of help you with the methodology and the search strategies, for example, or point you to resources where you can carry out your searches in a more informed way. I work with a lot of Indigenous populations, so we often have knowledge keepers and elders on the team. And the same, we might have patients on a team. We might have knowledge users on a team. We might have people from government. I've been on a lot of teams where we've had policymakers on from Manitoba Health who were going to use, they helped us design the methodology in order to make it useful for Manitoba to do policy development and implementation so that it would actually make a change and improve the health of populations in Manitoba. And as I said, sometimes you need statisticians if you're doing a meta-analysis. So writing your protocol is very important. I'm just checking the time. So we've got about 15 minutes and still have quite a bit of information to go through. If you need to leave, or if we don't get all of the slides done, if I don't get through all the slides, you will be able to access them later. But talking about writing the protocol. So it's really an outline. It's about transparency. So you want your methodology in a place that you've put it in a public place, so registered in OSF or Prospero. And you want that place there before you go and do a lot of data analysis. So you've done the background searching, you've written up a good protocol, you've looked to make sure that you have a novel question that no one else has tried to answer before. And if you forget to register the protocol, you will probably run into problems when you go to publish it. So when you so it's really important to write that protocol. It could have a little bit of information or a lot of information. It depends on the type of review. It depends on where you're also going to put it. So a systematic review, put your protocol in Prospero. Open Science Framework is for the scoping reviews or JBI. And also you have the option to, more and more people are publishing the protocols in a journal. So there's a couple of things to know about that. You don't have to publish your protocol. You just have to register it. So registration is free. Publishing a protocol will probably cost a lot of money. There's only a few journals that publish protocols for scoping and systematic reviews. They have quite large article processing charges of $2,000 or $3,000, and it will slow down your whole project because you have to go and submit the protocol for publication. It has to be reviewed. When they accept it, you have to pay for it, and then you can't have it too close to the publication of the protocol to when you're doing the data collection, or else you'll run into problems. Either they won't want to publish your protocol, so you've wasted time writing that, where you could have just submitted it to OSF for free, right? But also that you're just going to run into some problems because it'll slow your whole project down. So if you're going to publish the protocol, you can do it, but it will slow down your project by about 4 or 5 months. So, and you don't need to actually publish the protocol. You just need to register it. Talking about protocols as well, that's where you can put in your inclusion criteria, your exclusion criteria. It's very important to have clear criteria for what is going to be included in the analysis and what's going to be excluded. Yeah, it has to be specific and measurable. Document the reasons why you think things should be included or excluded. Use clear language, clear definitions. Refer back to your question framework. Often it's a very good idea before you actually submit that protocol to the registration. Pilot test it. See if the people that you've chosen to screen, you're probably going to be one of the screeners. Usually the lead author is one of the screeners. And find one of your co-screeners and pilot test 25 articles and see how easy it is to apply your inclusion and exclusion criteria. And you really should have some idea of why you've included something. So if you said, well, we're going to exclude everything published before 2000, maybe have an idea of why you picked that date. If you are only going to use materials published in English, that's just a limitation. It's okay to do that. It's just a limitation. So remember to write that up in your limitations in your final article. It's a good idea to look at different things in your protocol. Here's an example. And so the inclusion criteria is patient population of children and adults of any age. So age isn't a barrier, but they have to be visiting the emergency department. So there's a number of inclusion criteria in this particular PICOS model. There's some exclusion criteria. So these people have put it in a table. It's included in the publication. And so it's clear for me as a reader to read that and go, okay, they included people that I am interested in, or, this tells part of the story for things that I'm interested in. And so writing the protocol, I'm not going to open them up, but we did put in some examples from published example, similar to the one with the chart of the inclusion exclusion criteria, but if the whole protocol is in a published example, we've also linked to a registered example in one of the registration databases. Prisma P protocol guides you on what to report, and we've got a link to a sample protocol template. And this is really exciting to start pulling together your protocol. So now we're going to talk a little bit about searching the literature. We will go into that in 2 upcoming sessions, sessions 3 and 4. We'll look at that. And this is where it's talking about the systematic part of searching. So even in a narrative review, you can do and carry out good systematic searches. So you select appropriate databases, you use strong search strategies. So searching the literature is important for any type of review and to do it in a good way. You can use keywords, subject headings, combinations of them, depending on your topics and the strength of the database, the protocols in the database. And also when you do literature searches, and I'm going to show you this in sessions 3 and 4, how to, easily save your history of your search so that you can report it as part of your article when you publish. And so it'll more likely to get published because you've done your Prisma protocol, your Prisma reporting in a good way. So you have the search histories reported. And I'm going to show you how to do that quite easily, and also how to save your searches so that if it takes you a long time to do your analysis, you'll be able to rerun those searches just before as you're writing up the final article for publication, you'll be able to rerun the searches to see if there's anything new been published. So these are all really important things I'm going to cover in those sessions. And so this is an example of one search strategy for one population in one database. So this is just the concept of elderly people, older adults, and this is just one line. So some search strategies might have 30 lines. Some might have 300. Hopefully, most questions can be answered in a search strategy that's about 30 lines, right? So this is a whole bunch of different terms, but it's one line, it's one concept. And you might say, oh, I'm looking at something else in older adults, right? So you might say, well, this looks like a pretty good one. And this is from, I can tell by how it's set up. This one's probably from Ovid Medline or Ovid Embase, for example. because this is the terminology they use there, the syntax. And you might say, oh, I'm interested in older people too. Well, maybe I'll just use this. And you would certainly cite it and say, well, I used this from a certain one. This could be a filter that somebody has designed. So maybe a librarian has designed it. Maybe Ovid, the Embase vendor, has suggested it in their manual, said if you're doing older populations, here's a good one that we've tried and tested, and you can cite it there as well. You can also use it and say, well, I'm interested in this, but not all these terms, and you can focus your terms accordingly. So this is just one part of a systematic search. So searching the literature, as I mentioned, we're going to do that in depth. And then the exciting part of screening the articles, which is always a lot of work. So the better your search strategy was in the previous step, the easier your screening is going to be. So I often will be looking at a review and I'll look at the Prisma flow diagram and I'll go, wow, they looked at, 30,000 articles. That's a lot of articles. And that shows that perhaps they didn't do as good systematic smart searching as they could have. And if you look at 30,000 articles, it takes 2 screeners or 3 screeners or a team of screeners, quite a long time to do that. So it's better to actually spend more time on doing a good, effective search strategy that's comprehensive and effective and efficient, in order to have maybe 3,000 articles to screen instead of 30,000. And your title abstract screening could go quite quickly. So screening articles, we highly recommend Covidence. The University of Manitoba Libraries has purchased a subscription to Covidence. Covidence is a product that costs money, but we have links on the Knowledge Synthesis webpage to Covidence, to the paid subscription. You can sign up for an account or register your account there. And it's highly recommended. And why do I recommend it? I'm not a screener. I don't do screening like kind of help with the search strategies, but I'm not a screener. But all of the researchers who've come to me over the years and said, wow, Covidence is so good. We're using it. We're using it. And it was the people in nursing who helped me first discover how good Covidence was. So I'm grateful the University of Manitoba Libraries has paid for a subscription for you. There's a free one that a lot of people like to use called Rayan. It's been around for quite a few years, and it's free. A lot of people say, well, I've used it before, I'm going to use it again. But Covidence does have it's excellent. I can't recommend it enough. It can save you a lot of time. Sure there was something else I needed to say about that, but can't think of it right now. Okay, so screening articles. Your first level of screening is often title abstract screening. So yes, this is about my topic. It meets the inclusion criteria, or it might meet the inclusion criteria, or it clearly doesn't, right? So because you get lots of false hits. The best literature searches, the best design searches will still have a number of articles that don't meet the criteria. And we've got about 5 minutes left. So I'm going to have to go through this a little bit more quickly. But this is what Covidence looks like. It's very fast, easy to use software. And it lets you collaborate with another screener. You don't have to be in the same room, not even on the same continent. And this is what the Prisma flow diagram looks like. So hopefully people in this session have seen a Prisma flow diagram. This is one of the goals. This is one of the things you need to do to satisfy the reporting criteria for this type of review. Covidence will generate this for you, and it's editable so that you can make a few modifications if your methodology was a little bit different. Assessing quality, I don't do this myself. We point a lot of people to different tools that they can use, and we'll help you identify examples of other articles, other reviews that have used a similar tool. And again, this speaks to the strength of the analysis, the strength of the evidence, and eliminating bias. And talk about extracting data. it's important to use a data charting form so that each article that is being examined for full text inclusion and analysis, that they're actually the same criteria is being applied to each, and that you're extracting the same data. So that's very important. And we've put up, a lot of people use an Excel spreadsheet to identify the characteristics for each study so they can do some comparisons. But you can also use a couple of other tools that we've included. Different types of reviews will follow different extraction procedures. And this is an example of some software where you can do some data extraction and synthesize the data extracted using some software. And we can point you to that as well. Analyzing the data, it depends on the types of studies included. If you've got a lot of quantitative data, you might want to do a meta-analysis. If you've got qualitative, you might want to do a thematic synthesis. This is an example from Cochrane Library. And this is how they plotted it to identify the strengths of different types of evidence that was included in the analysis. And Cochrane Library's big medical database, analyzing the data for scoping reviews. We've put together a set of readings and recommendations for extraction analysis, specifically for scoping reviews. And writing up the results, all team members can contribute to the finished product. And we've put up a link to how to assign those contributorship roles. There's a lot of information out there, especially with the journal that you're going to publish in, how to acknowledge different contributors to the research project. And a little bit, just to wrap up here, going to look at systematic and scoping reviews in the sciences, humanities, and social sciences. And as I mentioned, so I'm going to be teaching how to do systematic searching in sessions 3 and 4. The focus is going to be on the background searching in Scopus, as well as searching in Ovid Medline with translation to Ovid Embase. So that helps with health sciences, specifically medicine, right? But what I'm also teaching is I'm teaching some Indigenous health sessions on May 22nd and June 4th that will cover some of the searching that you can do in keyword searching in interdisciplinary databases, which helps a lot of people who are planning on doing scoping reviews, for example, over in the humanities and the social sciences. So I thought I'd mention that. Non-health systematic reviews might be in everything from education to social work, agriculture, business, environmental sciences, engineering. So we have some resources identified for science, for environmental science, and for social sciences. It can always go and talk to your liaison librarians, your subject specialists in your favorite library that serves your faculty, and ask if there's different types of methodologies that they're aware of, because this stuff is being developed all the time. So reach out to your subject librarian. There's also an email that you can send to us at the libraries if you don't know who your subject librarian is, or you just want to connect with the right librarian to help you. And so yeah, systematic and scoping reviews are a lot of time. They're a lot of work. They're very exciting to do. Do a review because it's the most appropriate methodology as opposed to different type of research methodology. There's high quality and low quality systematic reviews. Which do you want to do? I insist that everybody do high quality reviews. So if you're going to talk to me, you're going to do a high quality review. Don't forget to register for upcoming sessions.